Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Joint injuries and disorders. Introduction. A joint is where two or more bones come together. Your joints include the knees, hips, elbows, and shoulders. There are many types of joint disorders, including arthritis, bursitis, and dislocations. Treatment for joint disorders depends on the cause and severity of the disorder. Treatments may include medicine, surgery, or other treatments. This program explains joint disorders. It talks about common disorders of the joint as well as treatment options. Anatomy. Our bones help us stand up straight. Our muscles help our bones move together. Bones connect at the joints. Examples of joints include the shoulders, elbows, wrists, hips, knees. We have joints between the different bones of our fingers and toes. We also have joints that allow our vertebrae to move. Vertebrae are the bones in the spine. Cartilage covers the ends of the bones of a joint. Cartilage is a tissue that keeps the bones from rubbing against each other during motion. There is a bag that contains a small amount of fluid called synovium between the two pieces of cartilage in a joint. The combination of cartilage and synovium allows for smooth, painless motion in your joints. A bursa is a small, fluid-filled sac that acts like a cushion between a bone and other moving parts, such as muscles, tendons, or skin. They are lined with synovial membranes. Symptoms. Many joint disorders have similar symptoms. The main symptoms are pain and swelling in or around the affected joint. The pain may be dull or severe. Certain activities, such as climbing stairs and straightening a limb, may increase pain. In some cases, the pain may be relieved by rest. Other common symptoms of joint disorders are a joint that locks or buckles, a stiff joint, clicking or popping noises from the joint, weakness in the joint. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Arthritis. Arthritis is the most common disease that affects the joints. Arthritis causes the cartilage in a joint to wear away over time. This can cause pain and swelling. There are many types of arthritis. Osteoarthritis is due to chronic wear and tear. The cartilage wears away and causes changes to the bone. It is more common in older people. Post-traumatic arthritis is due to trauma to a joint. Trauma may happen during a car accident or a sports injury. Rheumatoid arthritis causes swelling, redness, and tenderness in the joint. It is an autoimmune disease. This means the immune system attacks healthy tissue in the body. In rheumatoid arthritis, the synovium is attacked and becomes inflamed. This leads to damage of the synovium and joint. Other types of arthritis that can affect the joints include ankylosing spondylitis, gout, infectious arthritis, psoriatic arthritis. There is no cure for most types of arthritis, but arthritis can be slowed and controlled. Medicines can decrease inflammation in the body. Physical therapy can help keep joints affected by arthritis in shape. Splints are commonly used to prevent, slow down, or make up for joint deformities. If other treatments are unsuccessful, surgery may be done. Bursitis. Bursitis means inflammation of one of your bursa sacs. This inflammation happens in the soft tissue around muscles and bones. It happens most often in the shoulder, elbow, wrist, hip, knee, or ankle. A stiff, achy feeling around your joint may be a sign that you have bursitis. If the pain gets worse when you move or press on the joint, you may be experiencing symptoms of bursitis. The area around a joint with bursitis may also look red and swollen. A main cause of bursitis is overusing a joint. You may overuse a joint by doing repetitive tasks. Direct trauma to a joint can also cause bursitis. An example of direct trauma is slamming your knee against the ground during a fall. Your healthcare provider can treat the common causes of bursitis. Complicated cases may require referral to a specialist, such as an orthopedist or rheumatologist. Treatment focuses on healing the injured bursa. The first step in treating bursitis is to reduce pain and inflammation. Reducing pain and inflammation is done with rest, compression, and elevation. Anti-inflammatory medicines, such as aspirin, naproxen, or ibuprofen, can also help. For severe cases of bursitis, you may receive a corticosteroid injection into the area surrounding the inflamed bursa. Dislocations. Dislocations are joint injuries that force the ends of your bones out of position. Dislocations are usually caused by a fall or blow. They can happen from playing a contact sport or being in an accident. Dislocations are very painful. They may cause a joint to look visibly out of place. The joint may look swollen and discolored. You may not be able to move a dislocated joint. Dislocations are an emergency. If you think you or someone you know may have a dislocated joint, see a healthcare provider right away. Your healthcare provider will perform a physical examination to help diagnose a dislocation. He or she may order an X-ray or MRI to check for damage to your joint. Treatment of a dislocated joint depends on the severity of the dislocation. Your healthcare provider may try to move your bones back into the correct place. This is called reduction. After a reduction, you may be told not to use your joint for a while. This is called immobilization. Splints and slings are used to help with immobilization. Your healthcare provider may recommend medication to help with pain from a dislocation. This can include anti-inflammatory drugs and muscle relaxants. Physical therapy can help restore the range of motion and strength in a joint. In rare cases, surgery may be necessary to fix blood vessels or nerves damaged by a dislocated bone.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A joint is where two or more bones come together. Your joints include the knees, hips, elbows, and shoulders. There are many types of joint disorders, including arthritis, bursitis, and dislocations. Many joint disorders have similar symptoms. The main symptoms are pain and swelling in or around the affected joint. Arthritis is the most common disease that affects the joints. Arthritis causes the cartilage in a joint to wear away over time. This causes pain and swelling. There are many types of arthritis. Bursitis means inflammation of one of your bursa sacs. This inflammation happens in the soft tissue around muscles and bones. It happens most often in the shoulder, elbow, wrist, hip, knee, or ankle. A stiff, achy feeling around your joint may be a sign that you have bursitis. Dislocations are joint injuries that force the ends of your bones out of position. Dislocations are usually caused by a fall or blow. Dislocations are very painful. You may not be able to move a dislocated joint. Treatment for joint disorders depends on the cause and severity of the disorder. Treatments may include medicine, surgery, or other treatments.
Thank you for using Explain.